deal with the pheochromocytoma and their clinical features. So before we begin, the question is, what is the classical triad of the pheochromocytoma? In this video, you'll find this answer and learn in detail about the clinical features. So to begin with, firstly, we're going to look at the classical triad. So what are the components of this classical triad? The components include, firstly, there is headache. There is headache. And this is nothing but the most common symptom. Most common symptom. And then there is also sweating. There is profuse sweating. There's profuse sweating which is seen, as well as there is palpitation. There is palpitations. So there's palpitation as well as the tachycardia. So all this is present in the classical triad. Next, looking at the other symptoms, it includes the presence of hypertension. So this can be sustained as well as intermittent. And it is a most common sign. It is most common. Then there is also some kind of anxiety. There can be anxiety as well as there can be panic attacks as well. So just to recap what we did, we discussed the clinical features of the pheochromocytoma. So here we saw the classical triad. So this includes, there is headache, and this is the most common symptom, and then there is also profuse sweating, and there is palpitation and the presence of tachycardia. Then when we see, there is also hypertension. So this hypertension, it can be sustained, as well as it can be intermittent, and this is nothing but the most common. Then it is also maybe associated with the anxiety or the panic attack. Now we'll be looking at other clinical features. So we stopped at the anxiety and panic attacks. Then there is also the hyperglycemia. There is hyperglycemia. Then there is also the hypercalcemia. Then there is also, it includes pallor. So this pallor is nothing but due to the alpha-1 mediated vasoconstriction. It is due to the alpha-1 mediated vasoconstriction. And there is also presence of the polyuria. There is presence of the polyuria and the polydipsia. Then there also includes the orthostatic. There is an orthostatic hypotension which may be present. Then there is also the dilated. There is dilated cardiomyopathy and also the erythrocytosis. There is the erythrocytosis. So this is nothing but a high. There is a high hematocrit. There is a high hematocrit, that is the hemo concentration. So to recap, we saw the other features of the pheochromocytoma, that includes the hyperglycemia and the hypercalcemia. Both are hyper. Then there is also presence of pallor. The pallor is due to the alpha-1 mediated vasoconstriction. Then there is also presence of the polyuria and the polydipsia. There is association with the orthostatic hypotension. There is also a dilated cardiomyopathy. There is the erythrocytosis. There is a high hematocrit, that is a hemo concentration. Now we'll again continue with some more clinical features of the pheochromocytoma. So to continue, there is constipation as well. Constipation. Then there is also presence of the abdominal. There is abdominal pain. Next, there is weakness. There is weakness. Then there is weight loss. There is weight loss as well as the presence of nausea. So to recap, we saw the constipation, there is abdominal pain, weakness, weight loss and the nausea. Now we'll be answering our questions. So we asked just one question, that is, what is the classical triad of the pheochromocytoma? This includes, there is a presence of headache. So we saw there is presence of headache. So the headache is nothing but it is MC, that is the most common feature, that is headache, and then there is also profuse. There's profuse sweating. And after profuse sweating, there is also the palpitation. There is palpitations and also the presence of tachycardia. So just to recap, we saw the triad. This was the question asked. So the features includes headache, that is the most common, and then also profuse sweating, the palpitations, as well as the tachycardia. So this was about the clinical features of pheochromocytoma. To learn and grow daily, please do subscribe.